also control approximately, well, we have the Medicare and Medicaid. So we are big consumers and payers. And we're not, who's healthcare folks here? You got some healthcare? Aren't we good business partners, right? We pay, we always try to cut the cost, and then the insurance market follows us. You know how it is, if you follow how the federal government is. Well, just assume we take over the whole system. You think we're going to be great payers? That's my concern. Because here's the options, the options that are being debated in Washington right now. You know, option one for me is say, let's get these 44 million uninsured Americans. A lot of the countries they say are industrialized that have national health care have really helped those who have no health insurance get into the private market. Now, I like that. Let's get people into the private market. Let's make sure the private market makes sure that they have they have big enough pools and they have to accept people and all that stuff, but you keep it in the private market. The buzzword is, quote unquote, government option. And the government option would be get these 44 million uninsured Americans and put them in a Medicare, Medicaid type program. Government run, government managed. Now my concern with that is twofold. One is, if you know Medicare and Medicaid and you deal with hospitals and providers, you know, I have doctors that won't take some of these patients because they're not paying. So you think we're going to do that any better with 44 million and a new program, a new policy? Another problem is that if you're a business and you see a government health care plan and it's tough making the health insurance cost, why not just let them go? Why just let them go to the government option and just relieve yourself of that additional burden, especially if the policy is subsidized by us and it's not financially competitive. So then what do you have? Then you have really, and this is what started when Secretary Clinton, when she failed in her health care reform, in essence, they learned a lesson. The lesson was called incrementalism. We will get there over time through bits and pieces. And so now my concern is I'm on the health subcommittee. I talk about this all, and I state every time I have a health, my concern is in eventually moving to a one-payer system in which government rations care. And I'll end with this and open up for questions. So I'm doing okay, Bob? I've told the story. Steve's heard it numerous times, unfortunately. But about 3 weeks before the election, I'm at Southern Illinois University at Edwardsville. I'm at there. They have a nurse anesthetist school. I can say it. Nurse anesthetist. Close. And I've been there a lot. It's a good program. But they had the classroom filled. And usually you're talking small groups. This was a group of 30 or 40 students. And they were asking me about healthcare, and I was talking about a competitive product. I was talking about one-payer system, and I used the example of New Zealand. Government-run health insurance, one-payer system. And I said, what they do is they take your age, you take your earning potential, they take your liabilities, they put you in a big formula, and whatever the equation, the number is, the point total, based upon that point total, you either get care or you don't get care. And so a young lady, like she was up left side up against the wall, raises her hand. And she stands up, and I call on her. She goes, I'm from New Zealand. I'm thinking, oh. Either I'm right or I'm busted. So she said, my dad had kidney stones. Now, anyone have kidney stones in here? You know, confess. I'm fear onset. My dad's had it, my brother's had it. I know it's coming. I'm scared to death. Well, I had open heart surgery. I wasn't as scared as I am of kidney stones because I hear it's not fun. So she goes, he had to wait 8 months. 8 months to have this thing taken care of through the physicians in New Zealand. That is a one-payer system. That's what Canada does. That's why people come to the United States to access our hospitals. I am fighting for that not to happen because I do not want government making decisions. I've had a whole handful of friends, close relation, employees die over the last year. More than, I guess you just get these cycles. I can't tell you how many. So I've gone through this end-of-life struggle with some pretty close folks. The question is, who has to make those end-of-life decisions? You really want your church leader, for me to be a pastor or a priest, or someone of your faith tradition along with your family and your physician. Those are the folks who have to make those decisions. No way do I want a bureaucrat in Washington saying, 85 years old, it's just too costly to try to fight this fight. Right? And so those are the three things that I'm really worried about.